safe, conservative, and wonderful result, especially if you're looking to combine it with your traditional rejuvenative techniques like lifting procedures. And then we look at refinements. After you've done it for a few months and start seeing where you're going with it, and you see that I could have done a little bit more, you can always use your aesthetic judgment and add to that. And then really looking at the areas that are more advanced, the places that could potentially cause complications, and avoiding that on the front end. So this is a little drawing I did for the book, and it just shows you what I mean by a volumetric foundation, the areas around the eyes, the cheek, and the jawline, which are the critical areas to fill. Everything else is gravy. This is the area that if you combine this with your eyelid procedures and your facelifts, you get a very, very satisfied patient because they really can see what you've done. Refinements are just adding the little things and nuances, the areas that, you know, as you get a little bit more skilled in your experience level, where you could put a little bit more. And finally, things that may be complicated, the areas that are more, in my opinion, somewhat corrective in the upper eyelid due to overzealous prior blepharoplasty, and also temporal fills. And because, essentially, as we're surgeons, we're very visual people. We look at the face and understand the planes and work through that. Fat grafting is not as visual. There is a feedback as you see the fat go in. You start seeing where you want to start or stop. But a lot of it is tactile. It's using bony landmarks and feeling where you are going more than actually visualizing the planes. So we're going to go through some of those elements in a moment and make it a little bit clearer. But the easiest way when I start talking through this to help you understand the technique is to walk you through 3 levels. Essentially in a supraperiosteal deep plane, at a medium depth somewhere through the muscle fascial layer, and then somewhere deep, somewhere superficial closer to the dermis. Obviously you're not intradermal, but into the deeper to mid superficial subcutaneous layers. Pre-jowl sulcus. If you do a facelift and you're wondering why that jowl is still there, when you're done it's because you didn't fill the pre-jowl. You say, well, I'll put an implant, I'll put a pre-jowl implant. But think about one fundamental thing. That pre-jowl implant that you need to put in is, first of all, you got to go and make an incision, put the implant, alloplastic material, and it sits. Where does a pre-jowl implant sit? It sits on the anterior aspect of the mandible, correct? But where is the jowl? It's hanging over the mandible. So how is a pre-jowl implant sitting in front of the mandible going to efface a jowl that's hanging below it? So yes, a facelift is important. If someone's got a jowl there, I'm not going to promise them a smooth jawline without a facelift. But here's the trick. If most people don't want facelifts, if you look at the last 5 years, there's been a trend down from facelifts. So if I offer them an incisionless technique, it's much more captivating to the person out there. But the trick is, fat needs to be thought of as a 3-dimensional cylinder. Do you see those 2 cannulas there? You put it on the anterior aspect of the mandible, you put it on the inferior aspect of the mandible, and you transition over that. If you do that, you'll get a much better pre-jowl fill than any implant could ever achieve. So the postoperative care is relatively easy. There is no dressing, there are no dressings, no sutures, nothing to do. They just go home with some ice. I don't put any microfoam or anything on them. Just cut down dietary salt and a lot of Valsalva when bending over. That's the main thing. Usually the best way psychologically to prepare someone during the immediate postoperative period is to walk them through psychologically of how they will perceive themselves. The first week, they don't recognize themselves that much. The second week, they're getting there, but they're probably still very critical of themselves. Whereas other people looking at them probably think they don't look that bad. By the time they hit their 3rd week, that's when they begin to accept where they are. But almost every one of my patients only takes about 7 to 10 days off. And that's using other people's photographs during that time, videos, and using their own photos and following them really helps them understand this. Let's talk about the first goal, inverting the triangle. Do you think I did a facelift? Do you think I did liposuction? I did take a little skin from the upper eyelid, but the triangle has fundamentally been inverted for this 46-year-old. And I think I've actually somewhat undercorrected her lower eyelid, but you don't notice it as much because there's a nice balance of the face. The pre-jowl sulcus has been eliminated simply with fat, and this is held now for 14 months. This lady here is about 8 months out. If you look at her, it looks like she needs a brow lift. Looks like she may need a blepharoplasty. Looks like she may need a facelift or a cheek implant. But all of this is done with fat grafting. There has been no cutting at all. And if you see that there's a bony exposure of the upper eyelid, that is a fundamental problem. So what I did was I framed down the eye. What you see is initially is an eye bag. That's not an eye bag. That's an emptiness there. And you can see the triangle has been flipped. In fact, one of the major fears people have with fat grafting is I'm going to look fat. Which looks fatter, the lady before or after? How about the one before I just showed you? Which looks heavier? That's because what makes someone heavy is this. Is that right?
I'm going to bring this down so you can see a little better. It's hard to see.
Oh, okay, thanks. Thank you. If you look, do you think I took an eye bag out, or that I lifted the brows, or I took skin out, or did a facelift, or I put a chin implant? I didn't do any of those things. This is all done with fat grafting. This is about 9 months out, and I want you to see that there is a nice balance to the face. If you look at this, she's had a facelift on the left, but it's not really done anything. This is fat grafting around the eyes, the lower eyelid, the brow, and the jawline. If you can see, and she's lifting her brows a little bit, but that's positional inconsistency. But I want you to really see what the problem is. It's a fundamental bony attribute to the mid and upper face, and that is what I corrected. You don't need a brow lift here. And an eye bag would be a more assured way to achieve this result, but I've achieved it pretty well. And I always consult my patients that a transconj bleph, when the bag is significant enough, probably should be considered as a corollary to getting a good result there. The lady on the left here has had cheek implants, chin implant, and a facelift, but she still looks tired. She still has a jowl. The example on the right is shown just with fat grafting. I've eliminated the pre-jowl sulcus. I've actually, if you think about why the cheek implant has failed, when you get a bony upper face and you put an implant under there, what does it look like? It looks like bone. So what is the issue then? You know, if someone said, well, let me just eat more food. Well, if you eat more food, you just get a heavy face. I'm actually lightening the face with fat. I'm framing down the eye, and I'm actually, in this case, softening transitions, because a cheek implant exacerbates those transitions, further hollows the suborbital rim, it further hollows the buccal sulcus. What this is doing is blending. It's blending everything, and here's the other trick. What is the most feminizing attribute of the face? It's not going to be on your board exams, unfortunately. It's the anterior cheek. And if you see what the cheek implant was positioned, it was over the lateral zygomatic arch. That's masculinizing. So I want you to understand a different approach toward a feminine face. Framing the eye, the reverse of the brow lift and blepharoplasty. This lady on the left has been fundamentally altered. Her identity is not even the same. She's had everything taken away from her. Brows lifted, her skin removed, everything taken away. And what's amazing is, at least I can start with an old photograph. It's not a perfect result, and as I told you, fat does not eliminate lines. But at least I can slowly bring her identity back to her. And if you look, after 14 months, these are all, by the way, one treatment of fat. This is not 6 times, 8 times you read. If you look at that lower eyelid skin over 14 months, it's actually smoothed. What I will propose to you is my results begin to look excellent 8 months out. And they don't really look excellent until a year to year and a half out. That's a reverse to everything you know about fat grafting. If you look at this lady, looks like what are you gonna do to make that eyelid rejuvenated? It's skin shrink wrapped on bone. You're gonna do a brow lift? You're gonna take skin out? What skin? You're gonna take fat out? What fat? And if you think about it, if she didn't have surgery on the left, but that's what surgery does, is it takes the frame out of your eyes. And aging and surgery have done the same thing for her, but she hasn't had surgery. So it's filling. It's filling down the eye, the cheek, and the jawline, and creating, and she did not have a facelift. Would she benefit from a facelift? Fundamentally, yes. But she, you know, when you look at cost-benefits ratios and what you want to do when you get in the real world, this is what people choose. So using an old photograph, can we make a patient actually look like themselves in the past? Would you ever pull one out after you've done some work? Well, here's a lady at 55 on the left who's actually had a long coronal brow lift, and she still looks tired. There's a mini facelift as well as just adding fat around the face, cheeks, and jawline. And if you look at her at 40, I take all my old patients' photos and put them into my chart with me and Xerox them in color so that I can actually begin to see. And when I'm doing my procedure, I have my old patients' photos on the wall. I have their current photos up on my computer, and I have their old photos on the wall so that I can actually see where they are now and where they need to go. Because if you don't have a target endpoint, you're just shooting in the dark. And that's what we're trying to look at. If you look at the lady on the left, she's had a bad chin implant. I've done some lower corrective facial work, a little bit of peel under the eyes, tiny bit of skin removal. And if you look at the volumes, and I did a little silicone lip enhancement. But if you look at her in her mid-30s, is that upper eyelid heavy and low, or is it high?